Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I do mostly acne and scars, pigmentation, and a lot with collagen stimulation. I'm going to walk you through this particular case. Is a 36-year-old patient, Middle Eastern origin. We did a few different steps to get to this result right over here. We started working on her in April of last year. You could take a look and see that significant improvement over here for her scars in a matter of about 6 months or so. Sorry, about 8 months or so. This patient, we did initially something where we worked on her boxcar scars and her ice pick scars with TCA Cross, and then we also did some lasers, subcision, and then subsequently we did several more rounds of TCA, so about 5 rounds of TCA Cross for this patient. And you can see significant improvement over here for her scars. At this point, this is obviously, we're still working on it. We're still going to continue to improve it, but it's a really nice touch point right over here. So you can see just sort of what you could potentially expect with a combination session. And someone like this, patients like this sometimes do need multiple sessions, especially for their boxcar scars. Again, we did about 5 rounds of TCA Cross in this case. And then we also ended up placing a little bit of Bellafill for her as well. And then we did a little bit more TCA Cross the day that she came in, and then also some more laser. So I would expect, in about like 3 months or so, it's going to get even better. So it's really nice. It's a nice process basically to see that over time we could get that kind of improvement. Again, started the process in April of last year. And so I'll bring this down a bit so you can see it a little bit better. Hi, Ziomara. How's it going? Good seeing you on, by the way. Hopefully everything's been okay for you. And you can see, take a look at this. This is a patient with boxcar scars and ice pick scars actually over here. And so I'll showcase this right here. So I restarted this process because of audio. So hopefully you guys could hear me. I'm just going to do a little quick mic check. Everybody can hear me okay? I had to kind of reset the whole thing. So if you could, let me know. Otherwise, I'll just continue on. And if you feel like you can't hear me, just let me know too. So I'll wave. So anyways, though, okay, perfect. So this patient, we started the process in April of last year. Thank you, Mrs. Jones. Appreciate you guys. I appreciate you, Ziamara. And we ended up doing subcision. We did a TCA Cross for this patient. We did laser resurfacing as well. So we did a few different steps really to get to this improvement. And then when we ended up actually having her come in again at this point, we did some more TCA Cross and we did some more lasers. So she has done about 5 TCA Crosses at the time of this particular photo. And then we did some more TCA Cross and laser when she came in. She also had done some Bellafill as well. Yeah, I know this is an amazing result actually, Ziamara. Appreciate it. And it's a nice one because you can see this patient is 36 years old. A lot of times people seem to think that you can't get improvements after a certain point. 36 is definitely not old, but I have a lot of patients that are in their 30s will think that they can't get significant improvement. Yeah, hers are considered severe. These are more severe scars actually. She does have a lot of she has a lot of boxcar scars. Some of these are pretty deep as well. So these would be considered more severe scars. And I was talking to a patient earlier today about this because, what happens is sometimes when you're smiling or animating, you can see that volume depression. You can see the depth of the scars a little bit better. And you can see it certainly with this case as well. JJ is saying, can I start antibiotics a week prior to treatment so I can make sure my skin is clear for treatment? Well, yeah, you could, but I'm not sure. Why are you still breaking out though? We have to double check to see what's happening with that. But yeah, you could probably do some antibiotics before treatment. It may end up making you a little bit more sun sensitive though. So we got to take a look and see. Does adapalene help with scars? Yeah, it'll help a little bit with scars. This patient was on that beforehand as well. She had done some treatments beforehand. And nothing was really going to solve this other than this kind of more manual type of work where we went in and actually broke up the scar tissue, just undermine that scar tissue. Those are things that actually worked out really well. I'm actually trying to pull up, in this case, I actually pulled up a bit of my note here. So I'll take a look and see something. And she did, I believe, some microneedling sessions before in the past. And I got to double check about some laser. I just can't find that just off of this note right here. But she did a few things before she came to me, and she didn't end up getting, enough improvement until really she came over here. We ended up doing some TCA Cross like about 5 times in this case for her. Laser resurfacing, we did 1 for this particular point, and then when she came in today, or I should say in January, we did some more laser and then more TCA Cross. And she did have some Bellafill as well in between that time period. Reyes Accure is saying, I finally signed up for a consultation, waiting for time and day. Appreciate you. We do that virtually or in person. So anybody that's interested in getting a consultation, you could just schedule it directly on my website. And it's really, really easy to do. Anybody who does my consultations knows I basically can zoom in on all the scars, can really highlight the scars for you, and it makes it really easy for you guys. I could take a look and see like just exactly what kind of scar tissue you have, and then also just really showcase for you guys really what I would do to solve each of these. In this case, these are mostly boxcar scars and ice pick scars. Actually, I'll zoom in for you right here, and you can kind of see a little bit closer. Let me see if I can get up. Let's see. I'm going to get a little closer for you, and I'll try to see if you could see these kind of scars. So these are boxcar scars. They're deep though, and really what happens is sometimes is that like when they're clustered like that, it's kind of tough to actually to do one modality. Sometimes you do have to actually break up that scar tissue because there's a bunch of these like all clustered together. And when they're like that, they really do pull down in a certain area. And that's certainly the case for this patient. Again, she's a patient of Middle Eastern origin, so we had to make sure that we could normalize her pigmentation as well. And you can see that we ended up doing that as well. So her pigmentation was able to be maintained, and in fact, actually got better after her treatment. So that's partly what I do. I want to make sure that we're doing everything holistically. We're just it's a full comprehensive type of treatment program. So it's not pre-recorded. It's me right now. Hi, Fernanda. How's it going? Another patient of mine asked me that too, and I'll just tell you guys, I do always have this live on purpose. I'm never going to trick you and make it like a bot or make it anything else. So just if you find them not getting to your question, eventually I will. Sometimes you have to repeat it, but I mostly just try to go through an order if I can. And there's a few different platforms that I try to answer to on here. So I'll get to you eventually. Jerome is saying, oh, nice haircut, doc. See you in April. Look forward to it, Rome. Erica is saying, how do you treat deep forehead scars? Actually, those aren't too hard to treat. A lot of times they need subcision and then also a little bit of filler. And so subcision filler, really, those are the things that you actually use for that. Thank you guys. Appreciate everybody. That's all the kind remarks on here. Sana is saying, what makes someone a candidate for subcision? Good question. Really good question. So it's not just a matter of the fact that it's tethered. I sometimes just take a look and see how deep the tethering is, especially when patients are smiling. And really a lot of it's also by feel too. When we're doing virtual consultations, I'll have you smile. I'll have you kind of sometimes pull on it if I'm not 100% sure, just to double check to make sure that it's necessary for me to really release it. And there's certain different things I'll take a look at and see. Sometimes as patients are smiling, I see the indentation still. In some cases, actually, you'll see that there's volume loss really without any animation. So that tells you that there's some fat loss. And usually when there's fat loss, in the context of scarring, there's going to be some sort of scar tissue that's pulled down. There's going to be something that we're going to have to break up there. So that's one aspect. And I'll know that usually we have to do some subcision and a little bit of volume there. But there's other times that you may notice that I may not say to do subcision, and you guys are kind of surprised by that. During consultation, I'll say that's not really necessary. It's not that I don't think that it's tethered. I think that it's a pretty superficial tether bond, and it's not going to make much of a difference really for us, because maybe it's just one or two spot pockets or so that once they place a little bit of filler, when I'm doing the filler, I can basically break that up, or even other modalities that may end up needing to be done at that time. And it's like I don't need to do like a bigger subcision process. I only really do that kind of invasive procedure if I really need to do it. And so it's interesting, because even today I had a couple patients that were doing virtual consultations, and they were surprised that I wasn't saying to do just subcision, because it was relatively superficial for them. They did have a little bit of boxcar scar, and it wasn't something that's going to shift too much with some subcision. So there was no real reason to push subcision in that case. Was this done with subcision only? No, this was actually TCA Cross subcision and a combination of CO2 laser and erbium laser in this case. And then through the laser channel holes, I put a dilute form of Sculptra and Radiesse for this patient. So a few different steps. It wasn't just subcision in this case. And really for these kind of boxcar scars, subcision would help a little bit, but it's not going to be really enough to solve it completely there. So this was actually with blunt cannula subcision, not with Taylor Liberator subcision. So blunt cannula really with all this work over here. And then in this case, I also did a lot with TCA Cross. We did it 5 times at this point for TCA Cross. We did lasers. I did partially ablative for certain areas, and then I did erbium laser. What I mean by partially, I did fully ablative, but it was like for certain select spots, and then I blended it in with an erbium laser as well. So, this patient is mostly, FITS 4/FITS 5. You really would treat it as FITS 4, FITS 5. Have to be careful with her pigmentation, and we were able to do that. Is there a way to control oiliness of the skin? Yeah, a lot of patients today, I had to either place some like low dose Accutane, or we're starting the Accure laser. Really, those are things that you could potentially do to manage oil. If you're somebody who just has some mild oil production, then a topical retinoid, like a Dappling, could be a good idea, as really something over the counter you could do for that. Are these results typical? I would say it's consistent. Yeah, I mean, this is a pretty consistent type of result, I would say. The only thing that's good about this that I would say that's especially nice about this, I would say, is that it was a little bit shorter time period. So we started this process in April for her, and now we saw her in January right now. And I would say that it's a little bit faster than I expected. I thought that maybe it would take a few more months because she did have a little bit more oil production originally. And her pigmentation was such that I was worried, to make sure that she didn't have any hyperpigmentation, things like that. And she was actually really good with sunblock, really good with following my instructions, everything like that. And you can see that significant improvement. We're going to get better and better results, though. I just did the treatment on her a few weeks ago. Really just a matter of a few more weeks, a few more months, I should say. It's going to look even better. Are these results permanent? That texture is really hers. She gets to keep that texture. The scars improvement is hers. At this point, this is several months out. Again, we started April. Now we took this shot in January of this year. So this is her skin, and it's going to get better and better. If at this point she's really, really happy, imagine a few months from now she's going to be even happier, which is going to be awesome. Jacob is saying, I've had 3 phenol peels and still have ice pick scarring. Any suggestions? The thing is that phenol may not be the best option for ice pick scars. It helps a lot for the thick edges of the scars, but it's not really so much with the deep ice pick scars. Sometimes you have to do, just in this case, like we did, serial TCA Cross, and sometimes you have to do excisions as well. So it may not be that you have to do phenol over and over again. Alex is saying, Doctor, best option for really itchy skin due to not shaving after laser treatment. Thanks. Well, it's going to be really mostly, first of all, just dryness. So essentially make sure you're moisturizing with something like Vanity Cream. And then when you did shave, you got to double check to see what you're using when you're shaving. Actually, you could just use Cetaphil Gentle Cleanser for shaving, especially after lasers. And then don't use electric razors. I don't like electric razors. Use just a straight blade, or use like one of those Fusion 5, 6 things, whatever is on there, those blades. Just use those. Don't do too much with anything else. Let's see here. The Bellafill won't go away in the shower. Is the Bellafill permanent, basically, is someone asking. So 20% of it does stay integrated with the skin. We know at least for 5 years. Likely, most of us do believe that it's a lot longer than that, probably pretty close to permanent. It doesn't really get metabolized in the body. And then what happens is that your body makes collagen around that Bellafill, so it continues to get better over there. Do you recommend Subcision for brachioplasty scars? Not necessarily. Sometimes we do something more with like Radiesse. Could work very, very well for that. So like a dilute form of Radiesse, that could actually be really good. Is Accutane good for Bacne? Yeah, it's one of the best options for severe, for moderate to severe Bacne, especially. It's difficult for people to get good coverage, with skincare products, and it's an area that responds really well with something like isotretinoin, so that's not a bad idea. Do pores get larger when you age? Good question. Somewhat, depending on your oil production, that could end up happening. And then I would say also sometimes with elasticity, sometimes you may be seeing what you thought were pores, but actually it ended up being like more like scarring. So sometimes that could be the case. Does spironolactone give long-term results? No, it's a short-term type of solution for that oil production and the acne. But you may need something long-term like isotretinoin or like the Accure laser, either option really potentially for managing the acne and the oil. But it's not necessarily that that's going to be like a long-term solution. You could be on like a low dose of Accutane in the future. You could be on a topical retinoid. All those things could potentially happen. Shanraz is saying, does Subcision work for thermal damage to fat from CO2 laser? It's tough to say if that's going to be the case. Really, I doubt that there's going to be significant scarring from that. First of all, sorry that ended up happening to you. But you may want to just do something more with like volume replacement. So like fat, if you really do believe that it was fat loss, then probably the best thing to do is give you fat actually. So that sometimes tends to be the best option really. If you have under eye bags, why do doctors recommend filling in cheeks instead of filling under the eyes? And that's a good question, but really it's if you follow and trace along over here, you'll see like some hollowness in this fat pad right here in the mid cheek. And you'll see this groove occasionally. And you want to really support that. You want to give some support to that ligament. When you support that, a lot of times it does actually support the tear trough, the under eye. So it just depends on what the patient's natural anatomy is. A lot of times you just sort of have to accept that there is going to be a little bit of volume loss underneath the eyes. Just sort of accept it. You know, I have some people that really want it completely smooth and perfect, and that's when you're going to run into some problems. And I want everything to look really soft, really natural in life. Sana is saying, does low-dose Accutane need pregnancy tests and liver function? Yes, it does. It still does. At least as an initial baseline, you still need that. And by the way, the person was asking about bird bash. You were asking about under eye bags. If it's true under eye bags, so you may just need surgery, really. That's the thing. How long does Tretinoin take to clear skin? I mean, it may not clear skin completely by itself. It's possible that you need some sort of topical oral antibiotic, but the effects of Tretinoin do take several weeks. It could take like 6 weeks or so afterwards. So it's going to be a little bit slower than you think. But if you have, especially have like active comedones, you have cystic lesions, then consider doing something with some sort of topical or oral antibiotic. How many subcision sessions would you recommend before Bellafill filler? In the upper part of the face, really just one. Really, that's all I need to do. Lower part of the face, almost always just one, but sometimes every once in a while we may need to do two. But really, really rarely do I have to do more than one in the upper face. If I have to, I'll do it, but like really, really rare. I try to make sure it's broken up completely. And today's cases, I broke those up completely. That was really satisfying. Actually, oh wait, I don't know if she's gonna let us share. I was just gonna say, I did a case right now today for Subcision, and then we're doing a Phenol peel on her in a month, but I just realized I'm not sure if she's letting us share her result, but that'll be kind of cool because hers is gonna be really nice. You go in there and actually break up that scar tissue. Actually, I don't know if you're on right now, but it was a really interesting story, sad story. She said that she lost her fiance a couple years ago, and was really, really down as to be expected for something like that, a major traumatic event. And then this year just felt that like it was time just to sort of like take care of her own self, because she felt that like her fiance would be happy with that she was taking care of herself and improving herself again. It's a good feeling. It's a really good feeling that because we're going to get there and make her feel better about herself. So this is like this, one thing I do notice a lot of times is that like acne and scars is like this additional issue for some people. Like there's all these other problems, all these other issues that are out there. And then when you have sometimes acne or scars, it's like this, it's like everything now gets compounded. It's like it's extra stress for people. So I'm really happy that I could solve at least this part of life, something. Of course, I can't bring people back, but at least that we could help with managing the other parts of stress, and this doesn't have to be stress anymore. Like this patient right now, she's not stressed about this anymore. It's like really, really great feeling. She's super happy. And like a lot of patients, there's so many different things. Some people go through so much trauma and so much abuse and stuff like that, and they move on from it. And then it's like they're finally ready to heal. And part of the healing journey is really to like fix something that they never had the opportunity to fix before. And they know that it was like kind of a stress in it was like background noise for them. So it's nice that we could do that, and I really do like it when it's like for the patients themselves. That's the reason why they're trying to do these things, so it's that they can improve themselves, and it's amazing to get there. This in this case was 8 months out, but sometimes it can take a little bit longer, and you can see over time like that satisfaction and the happiness in patients. It's awesome. Let's see here. Christina's saying, I'm getting under the skin pimples. How do I stop getting them? You probably want to control your oil a little bit better. So again, like something like adapalene could be a good start. You could do tretinoin. That's also a good option. You may need something oral medication like that's going to control oil production a little bit better, depending on how bad it is. In that case, you may need something like oral isotretinoin, or what we do also is the Accure laser. All good options there. Opinions on tretinoin and clindamycin combo. I think it's a great combination for potentially a short burst. I usually don't do clindamycin for too long, topical clindamycin. You know what actually could be a better option though is a little bit of dapsone, or something sulfur-based. Dapsone works really well with tretinoin. It could be a really good option if you just especially moisturize. So you'll hear me say a lot of times that I don't really like to overly dry the skin with acne patients. I actually was with somebody when I was a teenager. They just kept on overly drying my skin. I felt it was really bad for me. It was just like constantly overly drying. And I ended up breaking out a lot more because when you're dry skin, you end up getting a lot more oil production to compensate. So I'm not a believer in like overly drying the skin, but dapsone, low dose tretinoin could be a great option for a lot of people that have some active lesions. Biochemy's, how's it going, Biochemy? Hi, Dr. Qazi. What was used here? So we did a few rounds of TCA Cross, about 5 rounds by the time she came to this point. We did a first initial process where we did TCA Cross. We did ablative CO2 laser at the edges of the scar, a fractionated blend of erbium laser. We also did blunt cannula subcision for this patient. And so we did a few different steps there that first day, and also through the laser tunnel holes, I put a dilute form of Sculptra for her. And then we subsequently did several rounds of TCA scattered throughout the next few months there. And you can see, it's already really nice. Then when she came in this day, we ended up doing some more TCA Cross, and then also some laser. So you can see it's going to get better and better. And then we're just going to keep on working a little bit on that volume replacement too for her. Is 45 too old to treat acne scars? Absolutely not. I've had patients in their 70s actually, and we still could get excellent results. Sometimes it could take a little bit longer, but we still got there. It's just, there's no real age limit at all. We could still wake up that collagen. Pamami is saying, how many times did she go to your clinic to get treatments, asking as I'm outside USA? Well, it depends on each patient. This patient, we ended up doing about 5 times with a TCA Cross, 1 time with the laser and the subcision. But sometimes we could maybe maximize this and depending on patient's downtime, how their skin is, what their skin type is. This patient is really closer towards more a FITS 5 patient. She's Middle Eastern origin, but she almost exclusively tans. And we have to be pretty careful with her skin type. She already had a little bit of pigmentation as well. So it was really important for us just to make sure that while she's healing, she doesn't get that hyperpigmentation. So we were able to get that. But some people may have, are okay with more pigmentation issues. Some people may have more downtime, more recovery between the sessions. So maybe we could be able to shorten it depending on each individual patient. It depends though. Osmani is saying, is it realistic to expect similar results after 1 comprehensive session? Osmani, depends on your kind of scars. I'm not sure. If it's more rolling scars, I would say, yeah. I would necessarily say it would be completely with 1 session because we'd likely have to do volume replacement. But pretty close, to excellent results after a single session a lot of times for a lot of rolling scars. Boxcar scars definitely take a little bit longer. Ice pick scars also take a while, but sometimes you'll see that diameter of those ice pick scars close a little bit faster than you would for those boxcar scars. So, I would say this is an excellent responder. In just a matter of a few months, we could see this. It's nice and it's realistic. This is it doesn't get more realistic than this. This is what you could, over and over now we get to this. It just sometimes could take 8 months, sometimes it could take 10 months, sometimes it could take a year, sometimes it could take a year and a half. That part is all variable, and there's a lot of different factors that could play into this. Your genetics, your ethnicity, all that factors into it. Your oil production, your sun exposure, your diet, water, not even just water intake, but what kind of water you're splashing on your face when you're washing your face. All those things can factor into it. Alex is saying, Doc, is profractional laser any good for deep acne scars or waste of time? Is ablative laser the only solution? Well, it's not about the laser. Even with a profractional erbium laser, you could just do multiple passes with that if you need to. But it's more about like precision and doing different modalities. Like in this case, we did TCA Cross. For the deep pockets of scars, we did the acid there to trigger a collagen response that was also breaking down the scar walls. It was reducing the diameter of the scars. So that's what we did for that. And then also we did subcision. We manually broke up the scar tissue. So if somebody's just promising an erbium laser, a profractional erbium laser for these kind of scars, probably would try to push away from that. I like this question. PK Farnsworth is saying, "Hi, Dr. Qazi. Can you tell us about your journey to becoming a skin restoration specialist with a focus on treating acne scars after your residency? Who is your biggest mentor?" Well, that's a really nice question. Thank you. And well, I actually have a video about it. I talked about the fact that I had acne, and my time was actually moderate to severe acne. I was on Accutane 3 times, and it was very, very resistant. I had very, very oily skin, and I went through multiple doctors, multiple dermatologists, and I did have access to it. My dad is a physician, and I was able to get access to all these, but I still found that there's huge gaps just for the acne portion of things. And then when I ended up having some scarring, and I wanted to solve some of those scars, it was like really, really difficult to find anybody to treat my scars, like exceptionally difficult. And I was pretty frustrated with the whole process. I ended up spending thousands of dollars on microneedling and Fraxel lasers, and they did almost nothing they did nothing for my face other than just like these grid marks that were there for like a week and a half or so. It was just like a painful process. I did 6 sessions of each of those, and I was just really like just kind of annoyed. And then I discovered that there was maybe a little bit of volume loss, and I was still young, but I was thinking maybe it's because of volume loss. And so then I went to somebody, a plastic surgeon in Chicago, and I wanted to ask him about Sculptra because I read about Sculptra at the time. And this was, 20 years ago or so. And I was thinking, Sculptra could be a good option because it's like longer lasting and I don't have that much time to go back and forth with filler, and it stimulates collagen production. So I did the Sculptra, I went to the consultation for the Sculptra, and I was annoyed because he was just upselling me on Botox, upselling me to do some under eye filler, all sorts of stuff. And it turned out that this plastic surgeon who advertised that he did Sculptra didn't even do Sculptra. So I ended up, until I really got into this world, that I realized that there's a way to do this very, very effectively. And it's about being very precise with the scars. So I kept on looking at my own skin, and I was thinking to myself, how would I solve this? How would I do this? And then I worked on it. And so that's really partly the journey. And yeah, I had a lot of different people that I would say I looked at and thought to myself that there's ways of doing this. There's ways of solving this at a very, very high level. And I was like, this is pretty cool that we could do this. So that's a short of it. There's a longer version of it though, but that's most of the gist of it there. Brick Boy is saying, "Hi Doc, is Phenol peel safe for Asian skin, and will it remove some deep acne scarring on the temples? Will there be pigmentation also?" So Phenol peel, think of it really more for patients with deep, thick scars, especially the thick elements of the scar. That's where it really works very well. You saw somebody on here earlier who said that they did 3 Phenol peels. That's really intense. 3 Phenol peels for their ice pick scars, and they hardly had results in improvement for it. And those deep ice pick scars a lot of times don't respond completely with something like Phenol peel, if at all. So you may have to do other modalities. But for Asian skin type, the biggest thing that you could be concerned about for Phenol peel is the prolonged redness. A lot of times, most patients, you'll get redness for about 3 months. But for Asian patients, it could take 6 months, even a year sometimes, depending on your sun exposure, depending on how you are with moisturizing, things like that. So it could be prolonged as well. Will it help with temples? Yeah, but sometimes you may still need volume replacement, like Bellafill, for example, Sculptra, all options there. Alex is saying, "Doc, I saw you in my dream and you were treating Abraham Lincoln scars and I was waiting for my turn." I didn't really know that Abraham Lincoln had scars. I actually did not know that. That's interesting. He had Marfan's disease. That's an interesting thing that he had acne scars. But appreciate it. Thank you. So I'll wrap up. I'll finish up with one last question over here. Let's see here. Okay, I'll do 2 last questions. Rick Boy is saying, is Bellafill safe if I had some keloids in the past? Yeah, we just want to make sure you don't have any active autoimmune conditions. That could be a potential concern. And then, of course, we want to make sure that, when we're doing this, that you otherwise, we're going to be clean. We're going to keep it really safe for you. But yeah, there's not going to be a concern with someone in the past of keloids, at least the way we're going to be doing it, the depth that we're going to be doing it. Hi guys, how's it? I see a lot of patients on here that are my current patients on here. Thank you guys so much for popping on. I'm going to wrap up tonight and appreciate everybody seeing that they've already seen nice improvement for their scars. Appreciate all of you guys for coming on, and hopefully I'll see you guys tomorrow. I'll be able to to answer some more of those questions. I see some more questions about phenol, and I'll answer those tomorrow. We actually have a few phenols coming up. I'll double check to see who's letting us share the video and the progress over there, and I'll to help you out with that though. But anyways, though, thank you everybody. We'll see you.